the treatment of the disease warts. When can you go and consult a doctor? See your doctor for common warts if the growth or painful or change in appearance or color. You have tried treating the warts but they persist, spread or recur. The growth or bothersome and interfere with activities. You aren't sure whether the growths or warts. You are an adult and numerous warts begin to appear which may indicate the immune system is malfunctioning. How will we diagnose warts? In most cases, your doctor can diagnose a common wart with one or more of these techniques: examining the wart, scraping off the top layer of the wart to check for signs of dark pinpoint dots, clotted blood vessels which are common with warts, removing a small section of the wart, shave biopsy and sending it to a laboratory for analysis to rule out other types of skin growths. How can we prevent warts? If you have warts, there are a few things you can do to avoid infecting others. These precautions may also help to prevent the warts from spreading to other areas of your own skin. You can do the following things to avoid infecting others: cover the warts with a waterproof plaster when you go to swim. Do not share towels, shoes, gloves or socks with others. Do not go barefoot at swimming pools or in communal showers or changing rooms. Do not touch the warts. In addition, the following things are recommended in order to stop warts from spreading to other areas of your own skin. Do not scratch or prick at warts, otherwise the virus might spread. Wash your hands thoroughly anytime you touch the warts. Keep your feet dry. Put on clean socks every day. Do not use instruments like pumice stones or nail files if they have previously been used on a wart. The effectiveness of these recommendations hasn't been tested in any study, so it is not clear whether they work or how will they work. Because the viruses that cause warts are highly contagious, it's hard to completely prevent them from spreading. Also, it is not easy to tell how someone got this, since it can take months for a wart to develop after the skin becomes infected. Because warts are almost always harmless and very common anyway, there is usually no need to avoid activities such as swimming and sports at school. How can we treat warts? Most common warts go away without treatment, though it may take a year or two and new ones may develop nearby. Some people choose to have their warts treated by a doctor because home treatment isn't working and the warts are bothersome, spreading or a cosmetic concern. The goals of treatment are to destroy the wart, stimulate an immune system response to fight the virus, or both. Treatment may take weeks or months. Even with treatment, warts tend to recur or spread. Now, doctors generally start with the least painful methods, especially when treating young children. Your doctor may suggest one of the following approaches based on the location of your warts, your symptom and your preferences. Stronger peeling medicine, salicylic acid. Prescription strength wart medications with salicylic acid work by removing layers of a wart a little bit with it at the time. Studies show salicylic acid is more effective when combined with freezing. Freezing, cryotherapy. Freezing therapy done at a doctor's office involves applying liquid nitrogen to your wart. Freezing works by causing a blister to form under and around your wart. Then the dead tissue slows off within a week or so. This method may also stimulate your immune system to fight viral warts. You likely need repeat treatments. Side effects of cryotherapy include pain, blistering, and discolored skin in the treated area. Because this technique can be painful, it is usually not used to treat the warts of young children. Other acids may be used. Minor surgery is also done. Your doctor can cut away the bothersome tissue. It may leave a scar in the treated area. Laser treatment. Pulsed dye laser treatment burns tiny blood vessels. The infected tissue eventually dies and the wart falls off. The evidence for the effectiveness of this method is limited and it can cause pain and scarring. Thank you.